In November 2002, a farmer in Guangdong Province, China developed breathing problems and was admitted to the First People's Hospital of Foshan. He'd caught a mysterious illness which ultimately became known as SARS, or Severe Acute Respiratory Syndrome. The disease proved fatal and went on to claim 774 lives across 29 territories. SARS and COVID-19 are two different diseases with different mortality rates, but they do have a lot in common. Both coronaviruses cause lower respiratory tract symptoms, fever, and a cough, and scientists believe their origins may both be linked to bats. However, the SARS crisis barely spread beyond East Asia and Toronto, with about 8,000 people infected, while the COVID-19 pandemic has triggered a global state of emergency, causing millions of infections worldwide. Why then is COVID-19 spreading in a way SARS never did? One major factor in how far a disease can spread is modelled by its reproduction number, which represents the average number of people a person is likely to infect during their illness. Because person-to-person infection can behave like a chain reaction, even small differences in reproduction number could explain a massive difference in how far a disease can spread. Estimates for the COVID-19 reproduction number are still being debated by experts, but surprisingly, it's looking eerily similar to that of SARS. But if a higher reproduction number doesn't explain the larger outbreak, then what can? One clue can be found in papers published during the height of the SARS epidemic, where the World Health Organization observed that there are currently no reports of the transmission of SARS from asymptomatic individuals. That means that the most infectious sufferers, most likely to spread the SARS disease, were clearly and visibly sick and likely to have already been hospitalized. SARS did have asymptomatic sufferers, but there are no reports of them ever transmitting the virus to anyone else. The possibility that COVID-19 could be transmitted by people who weren't showing any symptoms was an early concern of the medical community. On the 5th of March 2020, the UK Chief Medical Officer, Professor Chris Whitty, explained to a Parliament Select Committee that one possibility is that there is a large iceberg of people who have asymptomatic infection, so a very large number of people have been infected in Hubei without being detected. Studies conducted since provide mounting evidence that asymptomatic cases may be accelerating its spread. These cases have major policy implications for fighting back the disease, since after all, how can any government control a virus that is passed on by people who don't even know they're sick? The only way to act with certainty is by implementing widespread testing across the entire population, to identify and isolate asymptomatic carriers before they can infect others who may develop symptoms. If emergency protocols are put in place after COVID-19, just as they were after SARS, support for more rapid and widespread testing may be a prominent recommendation. In the meantime, the best thing we can all do to fight COVID-19 is to practice social distancing. Even though you may feel fine, there's a risk that you could transmit the disease to someone more vulnerable without even knowing. Stay safe and stay at home.